So actually the first and third rows will turn around and work in groups, and your groups will be assigned shortly. We're going to work in groups of 6 to 8 to 10 folks each. And each group will be provided with a problem-based vignette to solve. So you'll get a prompt that you'll have to discuss in your group. And we ask that you discuss in your group for about 20 minutes. Your idea will be in Slido as well. So what we're asking you to do then is record your thoughts in Slido for this using the assigned number on the form. So there's a number on the form that you'll get that you should use. Doctors Braun and Mertz will be available during this session to discuss with you, and then please contact us if you need technical support using Slido. Okay? After your discussion, we're going to have some groups report out to the larger group. We won't have time for everybody to report out, but we're going to ask a few groups to report out. So we're going to go ahead and then assign groups, and we'll give you that form. Go, please, Dr. Kim.
All right, I'm going to try to do my math.
Okay, okay.
Okay, so we have a variety of prompts. Each of you had a different prompt. A few of you had the same prompt. Before I volunteer this group over here on the left. Do we have any volunteer groups that want to go first? Okay, we got a volunteer group over here. I'm going to let you take your prompt back. If you could read your prompt to the group slowly, because these prompts are complicated, and then your response.
Okay, so ours were about leadership. The CDC recently released a report entitled Public Health 3.0, a call to action for public health to meet the challenges of the 21st century. The report calls for a new model in which leaders serve as chief health strategists, partnering across multiple sectors and leveraging data and resources to address social, environmental, and economic conditions that affect health and health equity. How can these chief health strategists be identified, recruited, trained, and implemented for oral health? So, could you do that part?
Oh, sure. She says that she took the easy part. Okay, so we were trying to identify who would need to be at the table if we were going to move forward with chief strategists. And we... Oh, sure. Okay. So we decided, of course, we started with third-party payers because we heard many times in the room today that money, money, money. So we need them. And schools of public health, educational institutions across all healthcare professions, data experts. We suggested AARP, or those who deal in the older adult realm, because we need to think across the lifespan. So those were our different groups that we identified as potential strategists that would be able to work together. For recruitment, it was suggested that millennials really like the push the cause. So, we would look at it from that perspective. Also work to identify key players in the first group who would be able to help develop a clear, concise, and consistent message for training purposes, so that we're all on the same page and we're not using the shotgun approach and everybody is confusing everybody because we aren't clear and concise. And one of the other things that came up as well was it's going to be really important to keep the consumers in mind, because if they aren't on board, we can do all the planning and all the thinking in the world, and they may not think it means anything. So it's really important to think about their perspective. And that's as far as we got. Ours was hard.
Yeah, that was hard. That was a great job. I think we had another group of that same prompt. Yeah? And so would you guys want to read your Slido comments on that same prompt? And again, the prompt was, you are going to try to build a chief health strategist. What do you need to help build that chief health strategist?
So I'll just add a little bit to that. Really, we talked about it, that we're all about integration today, so this health strategist has to be integrated. We can't have something just for oral health because we'll end up with silos as well. So that was really kind of the basics of our conversation, kind of adding to your piece.
You didn't understand that. I like you more, Lori. Other thoughts on their process, or other things that you feel are important to build that chief health strategist? Public Health 303, a call for action for public health to meet the challenges of the 21st century. Anybody from the CDC here? Or is that a stupid question? Right. Okay, very good. Second prompt. I'm going to come over to this group. Respond to your cohort here. Prompt in the...
No, I think this is... Just read that. Just read that. Oh, read this, read the question? And then you're going to give the answer. Okay, great. With Delivery Group 1, which reads, the current array of dental providers and dental care delivery models within which they work, for the most part, lack the infrastructure required for maximizing value under new payment models, including utilization of interprofessional teams. What would the incremental steps look like to move the models up the value chain, and how could the current workforce be redeployed toward that effort? What is missing that would need to be added in? And our response is?
Well, we did post it on Slido as well, but the main discussion that we had in the group was that the EHR, the IT systems need to be more integrated, and even within the dental system, what we see is if somebody's using a platform, they customize it so much according to their own needs that it doesn't speak to another dental system, forget about speaking to a medical system. So less customization maybe, and then to work to the top of the scope of the license. And that would be good for the entire team and help build and expand the dental team.
Yep, and in listening to this group, I heard comments about provider burnout, if they are spending too much time charting, so expanding your team to allow for somebody to be your scribe. Models like that are being tried in medicine. I don't know about in dentistry. Thoughts on their increments, did another group have number 1, same prompt? This is Delivery Group 1. Current array of dental providers and dental care delivery models.
Okay, yeah. So we had quite a few ideas about where to start. One of the things is national standards for licensure and certification across professions and across state, so people can move around to where they're needed. Medical providers given ability to supervise dental team members would be a helpful thing to integrate electronic records. One of my thinking on that is we don't have to have the whole dental record in the medical record to be integrated. We can integrate our notes and our health concerns, but the doctors don't need to see the charting. That can be a separate portal within the same record. I just keep wondering why we're fighting so hard and still can't get this done. But anyway, that's a whole nother conversation. And then my phone locked here. Let's see, integration in education. We even silo within dentistry. We don't often educate hygienists with dentists. Assistants get trained somewhere else. Technicians get trained somewhere else. So we need to educate all of our providers and health workers together, maybe within the healthcare system. I don't know. And reimburse other non-provider health workers so that we can track what they're doing and we can start paying more for prevention.
Thoughts, comments?
The one thing that I was thinking when we're talking about it, they don't really need all of the dental records. This is going to come over from the public health preparedness little part of my brain, is I think it would actually be kind of helpful if that were in there, because when we get into disasters and we need to identify, and I'm sorry, that we have to do that, but that I think that, that would give us another option. So we'd have it both at the medical and the dental office to be able to access their records if we need them for identification purposes.
The idea that health passport, it may not be a fully linked medical and dental record, but at least something that summarizes ideas. One thing that I've heard people talk about is using problem lists, and so the dentist can put problem lists on that is accessible by medical and dental, and then an assessment, a summary of what is happening under that problem versus a complicated note with a tooth chart that's more than probably is communicable. So maybe refining what
you could also
looks like.
You could also just say if they have an active diagnosis and whether or not they're at risk. I think that's basically all you need on the medical side to manage them appropriately. I'm not a clinician. I'm just saying that. I mean, you don't need the odonogram. You don't need to know that tooth 15 has a occlusal whatever.
So I heard a figure over here that Epic is the electronic health record for most, 86% maybe was the number I heard, for medicine, but Dentrix probably is the #1 electronic dental record for dental, right? So, so is there ever hope that those two might work together?
A lot of folks are going to Wisdom, a lot of folks are looking at Epic now, so and even the Henry Schein brought out one of the doing the integration. I think one was the dental school, not that interested. So I think we're starting to see it. I think the industry is going to try to do it, but it's not easy. And one of the things that no one's mentioned really are the dental practice acts in each state. You've seen one state, you've seen one state. Like I said over there, yeah. Thank you, yeah. It's really, that's going to be an issue as well.
All right, you want to go on to the next one?
No, I think we need to probably wrap it up soon. Unless, does anybody have any last minute thoughts on that? No. Okay, wonderful. This was great. Thank you, Dr. Braun and Dr. Mertz. Thank you, everyone, for sharing your thoughts. And so we're going to break, and there are some lovely pretzels outside for everyone to enjoy. And we'll be back here in about 30 minutes.